Without modern healthcare, my mother nor I would be alive today. During my mother's labor with me, she suffered many complications that women in other developing countries would not be able to live through. While pregnant with me, my mother experienced preeclampsia or high blood pressure that can cause many complications on its own. Then, after giving birth, she experienced severe hemorrhaging, which is bleeding excessively, and was in need of a blood transplant. Without the proper doctors and healthcare, she and I would have died. What is maternal health? Maternal health refers to the health of women during pregnancy, childbirth, and the postpartum period. It encompasses the healthcare dimensions of family planning, preconception, prenatal, and postnatal care in order to reduce the maternal morbidity and mortality. Women are greatly affected, but so are their families. The mortalities of the families not only cost the life of many women, but greatly affect the family members and their lives. According to the World Health Organization, approximately 830 women and girls die every day due to pregnancy or childbirth-related causes. The major causes of maternal deaths are postpartum hemorrhage, also known as PPH, and preeclampsia or PE/E, which together account for more than 40% of maternal mortality. Nearly 1.8 deliveries were attended by a skilled attendant, which means that the attendant has completed college and medical school and completed the residency program at the hospital of their choosing. 19 countries have improved skilled attendants at birth, which could include qualified doctors and sanitary tools. Over 1 million women were provided AMTSL, which stands for Active Management of the Third Stage of Labor, otherwise known as assistance during childbirth. 30 countries expanded PPH prevention programs. There were 450 deaths per 100,000 women in 1990. In 2008, there were 290 deaths per 100,000 women, and in 2015, there were 112 deaths per 100,000 women. Women living on the sub-Saharan in Africa have the most complications due to poor health care and inadequate doctors and sterile facilities. They have the most deaths per year, with almost 204,000 women dying just due to maternal health causes. Due to inadequate health care, there are complications of maternal health, especially in developing countries that contain poor or inadequate health care, especially to women who are expecting a child. Some of the most life-threatening causes are preeclampsia, untreated urinary tract infections, anemia, gestational diabetes, and malaria. According to OBGYN.net, high blood pressure complicates almost 10% of all pregnancies. Preeclampsia is a form of high blood pressure in which the blood vessels constrict, reducing the blood flow to the organs, especially the kidney, liver, and brain. The lack of blood can result in poor growth for the fetus, too little amniotic fluid, and placental abruption. Some of these causes may not seem harmful, but left untreated in the conditions of many of these women, they can become deadly. Without the proper health care, such as sanitary facilities, up-to-date medical technology, medications, or safe, healthy environment, these complications can lead to further one or more serious stages. There are also many complications that can occur during the delivery of a child. For instance, hemorrhaging. There are many organizations such as Women's Health Organization and UNICEF that help advocate and protect these women and change the standards of maternal health care in developing countries. UNICEF's health strategy also aims at building resilient and prepared health systems and provides service delivery in crisis context. UNICEF is trying to raise money to help provide care to maternal health. This can include training for doctors, building funds, and supplies for materials. Maternal health in developing parts of the world is a huge issue that needs to be addressed for the future of our next generations. When women don't have the resources and support they need to give birth, it affects not just them, but the members of their family and community and the generations to come.